Welcome to Dental Notes and Mnemonics, and today we are going to discuss about the densely sclerotic lesions. This video is the part 2 of the earlier video, hyperdense jawbone lesions. So without any delay, let's get started. So what are densely sclerotic lesions? Sclerotic lesions are the areas in the bone where a tissue becomes denser, almost like hardening process. On X-ray, these lesions stand out as brighter, whiter regions because they are more radiopaque, meaning they block more of the X-ray beam. So let's go through some of the most important common types and understand what causes them. On radiographs, a dense sclerotic lesion appears to have well-defined borders and often with a uniform radiopacity. They may or may not be associated with tooth or periodontal ligament, and they may also show no association with clinical symptoms or linked with the pain, swelling or infection depending on the etiology. All densely sclerotic lesions are benign. When a sclerotic lesion is observed in the jaw, attention should first be focused on whether and how the lesion is related to a tooth. If a lesion is related intimately with a tooth, the lesion is most likely odontogenic, and the lesions that are not clearly tooth related usually indicate the lesion of osseous origin. We'll talk about the odontomas. Odontomas are benign odontogenic tumor that are actually developmental anomalies, hematomas. They are not true tumors. They are most common type of odontogenic tumor as well. They are most commonly seen in the children and adolescent, and they may obstruct the tooth eruption, and about half are associated with the impacted tooth as well. It is made up of tissue which is native to teeth, enamel, dentine, cementum or pulp, and it is characterized by very slow growth and non-aggressive behavior. They are often discovered incidentally on radiographs. Two subtypes of odontomas are first the compound odontoma and complex odontoma. Compound odontomas contains multiple tooth-like structures which are known as denticles, and they are commonly located in the anterior maxilla, while the complex odontoma appears as a mass of enamel and dentine typically found in the molar region of the jaws. Odontomas are pericoronal, and this makes it different from the cementoblastoma. Treatment is the surgical excision, which is a standard treatment for complex odontomas. Teeth which are morphologically normal erupted or unerupted teeth, in addition to the full permanent tooth set, share the same pathogenesis as odontoma. They are due to the focal hyperactivity or the failed resorption of the dental lamina. Supernumerary teeth are extra teeth beyond the normal count. They may be primary or the permanent teeth, and radiographically they appear as additional smaller teeth, often with abnormal shapes. Cementoosseous dysplasia is an idiopathic fibroosseous lesion where the normal bone is replaced by the cementum bone or fibrous connective tissue. We have three subtypes. The first one is a periapical, focal and the florid. Periapical is the most common and it occurs near the roots of a vital teeth in anterior mandible. It can be solitary, multifocal or affecting multiple teeth. Focal cementoosseous dysplasia is located away from the periapical region, typically in the posterior jaw. And florid cementoosseous dysplasia is a diffuse form with the multifocal lesions in multiple areas of the jaw. Periapical cementoosseous dysplasia in radiographic image appears as dense sclerotic masses with well circumscribed margins near the tooth root. And the feature which distinguishes it from the other lesions like condensic osteitis and idiopathic osteosclerosis is radiolucent halo. Management part: asymptomatic cases require only observation. They typically requires no intervention due to non-aggressive nature. In symptomatic cases, enucleation may be considered. Now let's talk about cementoblastoma, which is a rare benign neoplasm consisting of cementum forming tissues attached to the tooth root, resembling an osteoblastoma found in other bones. It is most commonly affecting the mandibular first molar, and rarely it involves incisors, or sometimes it can occur in primary or unerupted teeth. Clinically, the patient may experience symptoms like pain or swelling due to alveolar ridge expansion. In radiograph, cementoblastoma appears as a well-defined radiopaque mass fused to the roots of the affected tooth, surrounded by a thin radiolucent halo with clear root attachment, helps it to distinguish it from the similar lesions like osteoblastoma. It often involves root canal invasion, root resorption, and displacement of the adjacent teeth. Treatment requires the complete removal of the lesion and the affected tooth to prevent its reoccurrence. Osteitis, which is also known as sclerosing osteitis or sclerosing osteomyelitis, is a form of chronic inflammation of the bone, typically associated with long-standing periapical infection or pulpitis. It results in the formation of dense sclerotic bone around the root apex of a tooth. Most commonly, it is found in the apex of the tooth, typically in the mandible. Clinically, it is asymptomatic lesion, but it can sometimes be associated with mild discomfort in some of the cases. This condition is often discovered incidentally on routine radiographs. Radiographic features involves it appears as a well-defined radio-opaque area surrounding the root apex of affected tooth. There might be a slight radiolucent halo at the periphery, which helps it differentiate from the other lesions like cementoblastoma. The lesion typically does not extend beyond the root apex, and it is not associated with root resorption as in case of cementoblastoma. Regarding the treatment, there is no specific treatment which is required for this condition unless there is ongoing infection. In cases of infection, root canal therapy or tooth extraction may be necessary. Excessive buildup of cementum on tooth roots is known as hypercementosis. In radiograph, it appears as a localized thickening around the roots of the tooth. Generally, no treatment is needed, but one should be cautious during tooth extraction because excessive buildup of the cementum may increase the difficulty level of extraction. Cementoblastoma and hypercementosis, both these conditions they affect the outer layer covering the roots of our teeth. Cementoblastoma is a benign cementum producing tumor that cause pain and swelling and may require surgical treatment. On the other hand, hypercementosis is a non-tumorous, painless overgrowth of cementum. It usually does not need any treatment as the tooth remains healthy. The key difference is that cementoblastoma is a tumor with a radiopaque mass and a radiolucent border, while hypercementosis appears as a uniform thickening of the cementum layer without any other symptom. So now let's discuss about the non-odontogenic sclerotic lesions. Idiopathic osteosclerosis is a localized increase in the bone density without any identifiable cause. It is most commonly found in the mandible near the apex of the teeth. It is usually asymptomatic, discovered incidentally on the radiograph, and radiographically it appears as a well-defined radiopaque lesion. As such, there is no treatment needed unless associated with the other symptoms. Osteoma is a benign, slow-growing bone tumor commonly found in the craniofacial region, particularly in the jaws and the paranasal sinuses. On radiograph, it appears as a well-defined, dense radiopaque mass. One more lesion which sounds similar with the osteoma is osteoid osteoma, but this lesion is typically smaller, measuring less than 2 cm. Is known for causing severe and localized pain, especially at night. A unique feature here is that the pain often subsides with NSAIDs. Radiographically, osteoid osteoma present as a central core known as a nidus, which is surrounded by a reactive bone, creating a mix of radiolucent and radioopaque areas. Like osteoid osteoma, osteomas lack the central nidus and don't typically cause a reactive bone response. For treatment, osteoid osteoma are often removed surgically, while osteomas may only need monitoring unless they become bothersome. Exostosis and tori are benign bony growths in the mouth. Exostosis are located on the outer jaw surface, while tori form the inner surface, such as the midline of the palate, where it is called as torus palatinus, or near the premolars inside the mandible, torus mandibularis. Both are generally harmless, but they may need removal if they interfere with the oral function or prosthetics. The appearance and the shape, oral exostosis are irregular or nodular bony protrusion, while tori are usually smooth and symmetrical. They are oval or round in shape. If we talk about the etiology of oral exostosis, it is often linked to stress on the bone from chewing or the bruxism. Genetic factors may play a role. But in case of tori, they are primarily genetic, more common in certain ethnic groups. Thank you for watching this video on dense sclerotic lesions. We hope it helped you to understand the key features of these lesions, how they appear in x-rays, and their significance in the dental practice. If you found this video helpful, please like, share or subscribe to our channel for more educational content. Feel free to leave any questions or comment below and we'll be happy to assist you. Thank you again for joining us and we'll be see you in the next video. Thank you. Till then, bye bye, take care.